In order to protect yourself from the coronavirus COVID-19, first, you have to know how it spreads. Since there is currently no vaccine to prevent coronavirus disease, the best way to prevent illness is to avoid being exposed to the virus. The virus is thought to spread mainly from person to person. It usually spreads between people who are in close contact with one another, especially within about 6 feet. Though respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Take steps to protect yourself. Clean your hands often and wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. Take steps to protect others. Stay home if you're sick, except to get medical care. Cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Wear a face mask if you are sick. If you are sick, you should wear a face mask when you are around other people, for example, sharing a room or vehicle, and before you enter a healthcare provider's office. If you are not able to wear a face mask, for example, because it causes trouble breathing, then you should do your best to cover your coughs and sneezes, and people who are caring for you should wear a face mask if they enter your room. If you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. Face masks may be in short supply and they should be saved for caregivers. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them by using detergent or soap and water prior to disinfection.